Alright, so my research focuses on the bluehead wrasse, which is a fish that it has the ability to change its sex from female to male based on social cues and social need. So I chose to do my dangerous idea presentation on a related topic involving the ethics of gender reassignment surgery in minors. Alright, so some terms to acquaint yourself with. Biological sex is the sex that you are born with based upon your genes. Some examples include male, where you have X and Y chromosomes, or female, where you have two X chromosomes, or many others that are possible. Gender identity is the range of characteristics pertaining to and differentiating between masculinity and femininity. So this is a social construct based upon our reactions with each other, and it is also important to understand that this is on a spectrum, so people can definitely be somewhere in between. This gender unicorn here is something that they have begun teaching in elementary schools. It's actually very informative. But there's also a lot of controversy regarding people that don't want it to be taught in schools. So, gender dysphoria is a condition in which people feel strong, persistent feelings of identification with another gender that they were not assigned. So this can cause a lot of discomfort and a lot of struggle in their daily life, including feelings of depression, anxiety, and suicide. As you can see here, the suicide attempt rate among transgender persons ranges from 32 to 50% across the country. So this is the attempt rate, not the actual suicide rate, but that is still a very, very high number. 1/3 to 1/2 have attempted it. So this is a very serious condition, a very serious problem, something that needs attention, and definitely needs to be understood better. It does affect a small percentage of the population, just under 1%, or much under 1% of males and females experience gender dysphoria. So, gender reassignment. There are many ways that a person can begin to reassign their gender. The first and probably the most easy way is social reassignment. This includes dressing, acting, and identifying as the opposite gender. This would include things such as cutting your hair to make it look a different way, or wearing makeup, or participating in different activities. Studies actually show that children that reassign socially are just as mentally healthy as kids with no mental health issue. In contrast, children that with gender dysphoria that do not reassign socially often experience severe anxiety and those other things that I mentioned before. So it is actually something that is very healthy, and parents should be allowing their children to do these things if they are approached with that. Hormone therapy includes taking testosterone or estrogen, or even puberty blockers, to allow the person to start developing as the opposite gender would, or in the case of puberty blockers, to just stop puberty altogether so that they have more time to kind of explore. This is available as a way to, although it is not reversible, it has been shown that it can help the psychological state of people with gender dysphoria that are developing, especially. Reassignment surgery includes actually physically changing the sex organs of the patient to be of the opposite. This is irreversible, and important to mention that it actually cannot be done on children. It can't be done. It isn't considered as an option until you are over the age of 18 or older. So there's that. Yeah, as I mentioned before, gender reassignment surgery is only offered to adults. Hormone therapy, however, is available starting at the age of 12. That does include puberty blocking and estrogen and testosterone, with the consent of the parents. This sparked a lot of outrage in places like California and Oregon, where people were very upset that children were given the ability or the opportunity to receive hormone therapy treatment without the consent of their parents. If they were foster children, or in Oregon at the age of 15, even if they are not foster children, they can seek out and receive hormone therapy if they are competent and understand the risks. This should be considered a win for medicine because it allows the children to receive the treatments that they need, and it allows the doctor to treat in the best way that they feel possible to help the children. However, many people believe that it is a bad idea to allow children this freedom. Here are some myths about gender reassignment. It is a common misconception that minors who transition are likely to change their mind upon maturing. A study cites that 1.9% of patients who hit puberty and used puberty blockers decided to stop treatment. So that would be 98.1% of patients that decided to continue. So that it is very rare for them to change their mind. Furthermore, a 2017 study found that 94 to 100% of people who had gender reassignment surgery experienced surgical satisfaction. So it is something that has made a lot of people happy. Another study found that sex reassignment conferred no advantage in terms of social rehabilitation. This is a very controversial study, however, and had a very small sample size. So many other studies were published disputing that, and found the opposite. As I mentioned before, 94% of very high surgical satisfaction rates. It is also another misconception that doctors are mutilating children that are confused about their sex and just need time. Well, as I stated before, you can't even have reassignment surgery until you're 18, so this is not possible. As for our political state, currently, the Trump administration has declared that they want to define sex legally. They've already started to limit the transgender rights and invalidate the community altogether, which would make it even harder to receive treatment and would send a horrible message and would cause a lot of grief. In conclusion, it is important to understand that gender reassignment is a very useful tool for people with gender dysphoria, and it is important for us to recognize that patients should be able to make decisions with their doctors for their best interest, and not to limit these freedoms. Thank you.